Good morning, Nigeria and the rest of the world. Thank you for joining us on today's edition of TVC Breakfast. I am Veronica Boy.
And I'm Ibrahim Shita. Thank you so much for joining us on TVC Breakfast. So happy to be here with Veronica, even though we cannot miss our own colleagues.
Our colleagues.
They're doing fine wherever they are.
Of course.
And they're watching.
Definitely. And we are keeping the house warm for
most
them.
Definitely. Most definitely.
Anyway, like we rightly pointed out, we'll be looking at an appraisal of the president's 2-year tenure. They call it midterm tenure, as it is. And then we're also looking at the matters around the mass defections that we have been seeing in recent times, the different perspectives being raised across the cross-section of the society. But first, let's begin with the story where the Federal Executive Council has approved the establishment of Medipool, a new purchasing organization designed to drive down the cost of essential medicines and improve nationwide access to high-quality pharmaceutical products. Coordinating Minister of Health and Social Welfare, Professor Ali Pate, made this announcement after the Federal Executive Council meeting presided over by President Bola Ahmed Tinubu at the State House in Abuja. TVC News State House correspondent Femi Akonde has details.
After swearing in the 2 new national commissioners of INEC and the newly appointed members of the Code of Conduct Bureau, the Federal Executive Council dissolved into deliberations on other matters. FEC approved a 2.3 billion naira contract to boost local drug manufacturing and curb medical tourism. The 2 initiatives aimed at strengthening Nigeria's healthcare system will lower the cost of pharmaceuticals, and the second one will improve cardiac care in the Northwest.
That executive order provided incentives for local manufacturing by taking away tariffs for imports of raw materials so that we can encourage our local manufacturers. There's an element of that executive order which is to allow us to shape the market by aggregating the demand in the Nigerian health space and channel that demand to encourage our local suppliers.
The federal government says it is considering new legal measures to curb the theft and vandalism of public infrastructure, including scrap metals and other government assets, following rising incidents of illicit activity across the country. The Minister of Information says the government has observed an alarming increase in the theft of metals and components from critical infrastructure such as bridges and public roads, often carried out at night by individuals seeking to profit from reselling of these materials.
We already have some of these laws in existence, but we are looking at them in depth, and the Attorney General of the Federation has been directed to look at that.
For public servants in the country, a 1-year group life assurance scheme was approved, reaffirming the government's commitment to the welfare of federal public servants.
This means that if the unfortunate incident of death occurs, the deceased public servant's next of kin stands to have a benefit to help the family, cushion the family at that time of loss. This year, the Group Life Assurance Scheme covers key government officials. The scheme also covers the paramilitary agencies.
In the 2025 national budget, the federal government earmarked about 17.3 billion naira for the provision of group life assurance for employees of ministries, departments and agencies, as well as members of the National Youth Service Corps. Femi Akonde, TVC News, Abuja.
All right, a majority of Nigerians will say this move by the president is a step in the right direction. Recall that the presidents have been looking at ways to lower the prices of pharmaceuticals and also to boost local manufacturing. And it's good to hear that he approved 2.3 billion naira contract to encourage local manufacturing and also curb medical tourism, as we have often spoken about it, and ensure that this money stay with Nigeria. Right. I believe this is in line with his policy of Nigeria first, as it is, and he's already taking the step. But it's good that we are borrowing models from countries like South Africa, Kenya, Saudi Arabia, India, and some other countries that we see that this kind of model has worked, and we're adopting it to see how it will work in Nigeria. I am hoping that these countries or these businesses that will be coming together to form this pool will not sabotage the effort of government, because it is a pool of private and public, organizations and businesses who are already in this chain of buying, supplying, and all of the chain in this sector to ensure that, okay, they can lower prices competitively, and then Nigerians can have access to not just medicine, but quality medicine to address their healthcare problems.
Absolutely, Veronica. I'm so happy with this new initiative by the federal government, and it goes to show that, yes, they're walking the talk. It's different for you to say one thing that, yes, we'd like to do this, or we hear Nigerians asking us to do this, and they're not doing anything to make sure that people have quality access, access to quality healthcare. If you look at Nigeria's out-of-pocket healthcare spending, is among the highest in Africa.
Absolutely.
Pharmaceuticals often make up a bulk of this burden, and you have people dying needlessly, where you have patients, whether inpatients or outpatients rather, they say, okay, you need to, apart from this injection, apart from the fact that you pay for your using our facilities, then you have to buy drugs, and then you now start imagining, is my life or the cost of this drug worth my life? Or is my life worth the cost of this drug?
Right.
That you now find some people even begging for, for death, something that is needless or something that is avoidable. So this new strategy, I believe that, as you said, is a response to both economic pressure and moral imperative, ensuring that no Nigerian is priced out of healthcare. If you recall recently, especially when the fuel subsidy removal was announced, that policy was introduced by this administration. The spillover effect affected companies like the GSK and some of them who were moving out of the country, at the point in drugs. So I believe this will also bring them back to the country. So because Medicare, the cost of Medicare should not kill people. It should be easier for people. I mean, life should be easier for people, but not hurt them.
Absolutely. That is why we have insurance policies.
Yeah.
I would also believe that we take a step at ensuring that we deepen access to insurance in the rural areas. Some local areas, they do not have access to quality healthcare or even primary healthcare, as the case may be. Some persons have to use traditional birth attendants, when it comes to the matters of delivery. So if they can have access to, insurance, the policies, no matter how little it is, they will take advantage of it and then educate people on the essence of having, access to this quality. I want us to make it a holistic approach.
That's right.
But this step is a step in the right direction. Kudos